Okay, so here's the question. How many people do you know that are lucky enough to have two birthdays? Well, if you know me, you know at least one. And that birthday is Friday, April 2nd. And it's my second birthday. So despite my appearance, I am really only 2 years old. And I'll explain more about that in a minute. It is Tuesday, March the 30th, 2021. Journal 411, T+726. And I'm pretty sure that's right because we're counting backwards from Friday. I received my transplant birthday on the 2nd of April, 2019. And there's a lot involved in that, a lot to reflect upon, a lot to think about, a lot of lessons that I've learned over the past number of years, starting with diagnosis in 2014, primary myelofibrosis, bone marrow cancer. This is a pretty important birthday, according to the City of Hope, because it's the birthday that'll help determine how close I am to being cured of the myelofibrosis. And there's been a lot that's gone into that. So it's important. And this blog is important, and it's been important to me. It started at the request of a dear friend, Brett Modesti, who worked with Team in Training, and the local Team in Training group were among the angels in my recovery. And I really deeply appreciate everything that they did, the blood and platelets and whatever else they were asked to do. And that's a big deal. But realistically, as I said in the blog, where there's life, there's hope. And my hope when I was diagnosed was to go ahead and change my physiological birthday, and reduce it in comparison to my chronological birthday. And I guess I was successful in doing that because I was accepted in the transplant program. Otherwise, we wouldn't be having this discussion. And most people would be talking about what a great guy I was. And hopefully that's not going to happen for quite some time. I was successful in becoming fit enough to reduce that physiological age to the point where the doctors were convinced the transplant was less likely to kill me. And I say that with all due respect, because realistically there is a 35% chance that you're not going to make it. Of course, that means there's a 65% chance you will. But the issue here really, as I get closer to the birthday, is the lessons that I've learned along the way. And I think they're important. To name a few, one of them certainly is patience, something I was never known for in the 72 years prior to the transplant, or the 68 years. I guess it was 68 years when I was diagnosed. But I've become incredibly patient, recognizing that all things happen when it's time for them to happen. I've also developed a whole new appreciation for things like understanding and empathy and compassion. It's hard not to. There's no way to go ahead and explain the impact it's had with regard to gratitude or grace or appreciation for all the small things in life that you take for granted, the ability to take a walk, being able to swallow without pain. I think more than anything else, it's helped me recognize the incredible gift I've been given in this second chance that I have to get it right, to live the life I was meant to live among the people who I care about so deeply. A second chance at life living. But one of the things that I didn't write about in the blog, or a couple of things that I didn't write about in the blog, are a few other things that it helped with. It helped with being stoic in the face of pain, unfazed, resolute when confronted with pain and discomfort, and to always put gratitude and appreciation first, and perhaps even to cherish the ability to put the other first, to think about other people and how to serve them more than to selfishly put yourself in the center of your own universe. So I invite you all to celebrate my second transplant birthday with me. Positive thoughts, smiles, and best wishes will work fine. Being here is really present enough. Being here in the present is really present enough. In the meantime, stay well, stay strong, stay focused, stay home as much as you can, and take care.